This is the Dover Download Podcast. My name is Christopher Parker, and for the past 25 years, I've had the pleasure of working with, learning from, and talking to a variety of volunteer, staff, and community members. This podcast explores conversations, activities, and a variety of policies and programs which exist here in Dover to improve the community in one way or another. Early in the month of May, I was asked by a resident if City Hall was lit up green because they were supporting the Celtics. And while I said that might be an unintended consequence, know that the tower at City Hall was lit up green in support of Mental Health Awareness Month. I hope that resident is listening to this so they can learn more about that. We have Suzanne Weete here to talk to us all about the value of mental health, why she supports staff here in the city of Dover, but throughout the Seacoast community, and making it aware that mental health and physical health are equally as important, if not more so important, today. Suzanne, welcome.
Thank you. Thanks, Chris, for having me. It's great to be here.
It's great to have you. As we said sort of off air, it's kind of surprising it's taken this long to get you in that seat.
I know it. I'm glad to be here. Been a Dover resident for a long time, so this is pretty cool.
All right, so let's build off that. You've been a Dover resident for a long time.
Yeah.
What else should the listener know about you? What brings you here?
Well, I've been a Dover resident, 24 years. I have 3 kids. 2 have already gone through the school district and one's still there. I've been a member of the community in lots of different ways, as a volunteer, as a coach, as a member of the parent-teacher groups, the elementary school, the boosters clubs, all that. And I've also worked in the nonprofit world for 23 years here in Dover, serving Stratford County and beyond with really 3 missions that have been really dear to my heart. Currently, I'm with Community Partners, which is a local community mental health center, as well as area agency working.
A great asset to the community on its own.
It is. It's great. They do such wonderful work. And but I've also worked for a long time ago at the Hub Family Resource Center. Yeah. I also worked for a Community Action Partnership for many years, but now it's Community Partners. And from this work, working within the Community Mental Health Center, because of some things that happened in our community over the years, I just thought as a parent that we really needed more mental health education in our community. As a parent, I want to make sure my kids are healthy, and that I also want to make sure, all kids are healthy as well as adults. But because of some things that happened in our community, I just felt like I was scared to death. I wanted to make sure that kids were safe, knew that there's resources out there. But I wasn't even sure of the resources, so I had to start to learn. And I started to do work with the superintendent of schools, Dr. Bill Harbin, to bring community members and organizations together to start talking about mental health. And I didn't even know where we were going to go with that or what we were going to do. So from that, we built what we call the Dover Mental Health Alliance, which is a grassroots community-driven coalition dedicated to mental health.
As I said, I think that we are at a point where the average resident, average listener understands that mental health and physical health are evenly important. Mm-hmm. And that for a long time, you had a very strong emphasis on physical health, and mental health was something you didn't talk about. If you thought about it at all, it was in your own dark mind.
Mm-hmm. That's right.
And I won't imply that you're my age, but I'll say generationally, we're probably close to generations.
I think so.
That is our generation has gotten older. There's been a better awareness, and I think our kids, it's not even a question of awareness. It is, mental health is important.
Yeah.
And it's interesting to me, and I'm curious if it's interesting to you, this awareness, this sort of that, we need to take care of our minds and as much as our bodies.
That's right. Well, if you think about it, we are still dealing with an opioid situation. And I remember sitting in Dr. Harbin's office years ago, this was 2018, saying, when we talk about substance use disorder and that sort of time, the time frame when it was really high at its height, but it's still here. Think of all the kids that were impacted by that, with a parent that may have passed away or, is affected by, substance use disorder, and how that's going to impact that kid's mental health down the road. Because that is an adverse childhood experience. It's chronic trauma for a kid to have to actually witness a parent overdose or die, or, whatever the ramifications or the consequences are of that illness could be. And that is an illness. Substance use disorder is an illness. It's not, no one chooses to have substance use disorder, just like no one chooses diabetes or cancer. And I remember sitting in there sitting with Dr. Harbin saying, what's going to happen to those kids that have dealt with that? Like, they're going to have potentially higher risk for mental health challenges down the road. And then the pandemic hit. Yeah. I mean, it was a double whammy, And so if you think of, not only as adults, we can talk and think about this and hopefully talk about these things, but kids don't. Kids are just, they're kids. They're going through things for the first time. And so they've had to deal with one real kind of really sad crisis. And we've really devoted a lot of resources to substance use and recovery and treatment centers. I was just at a meeting prior to coming here talking to the social worker from Dover Police Department saying there's been a lot of emphasis on substance use treatment centers and resources. We have the doorway, things like that in our community. But what about mental health? We don't have as many. We have the community mental health center, for sure. And we have therapists and we have clinicians, but the need is so great for people to have those services that, as we all know, it's so hard to get an appointment. And that's no fault of the community mental health centers or the therapists. It's just the need is so great.
I wonder, as you're talking, if part of why the substance abuse side of things gets a different attention is because there's a physical thing that's readily associable. So whether it's alcohol, whether it's drugs, whether it's gambling, whatever the vice, someone can point to and say, if you stop doing X, that would be a good thing, versus a more intangible mental health, PTSD relating, or verbal abuse, or those sorts of things. It's less easy for me to look at someone and say, hey, if they just put that down.
Right.
And I wonder, that's an interesting dichotomy, I think.
And that's a stigma that's associated. I mean, generationally, we're about the same. And we think about growing up, we had movies like One Flew Over the Cuckoo's Nest. What has the media done talking about, people that are mentally insane? I mean, that's so passe. It's a joke, right? And it's stigmatizing against people that have a genuine health issue, right? And people aren't born with depression, or people aren't born with bipolar. These things just occur, and no one asks for those. Just like no one, talking about you can't see somebody with a mental health challenge or a mental illness, you can't really see what's happening. You can't sometimes see if somebody has diabetes or cancer. It's another illness that we should treat it as such. But because of the media for years, decades, we had
conditioned a certain way.
Yeah, we've been conditioned. We had institutions and things like that. But really, mental health challenges and mental illness, they are health problems.
And this might be a bias on myself, which I admit. I'm just like everyone else, that we come with biases.
Absolutely.
One of the things I think is interesting is the language that we use, right? So if you have a substance issue, you go to a recovery center. If you have a mental illness, you go to an institution. We're not talking about how to help you recover. We're talking about institutionalized.
Right.
And so right there, we've created a track that doesn't equalize or say both are important to address and we need to help you.
Going back to what you said earlier about kids and youth and how they're so much more open to talking about mental health challenges, or if they're taking medication or that kind of thing, they're much more open to talk about it. And they'll be more open to talking about I had to go to a hospital for a mental health crisis, because that's what we have now. We have hospitals. We don't have enough beds in the state. New Hampshire's kind of has a long way to go to really address how to actually treat people with mental health challenges who might be in mental health crisis. But kids, that generation is going to come up having a different vernacular around it versus when we were younger, because those institutions don't really exist anymore.
And in some ways, and I'll include off Mike Gillis here, who's listening in, we're all of that same generation where I'll say we're a transitional time frame. Our parents' generation wouldn't have even talked about this at all. They would have said, suck it up, buttercup.
Absolutely.
And just deal with it on your own.
That's right. They wouldn't even say cancer.
Right. Exactly. So we're transitioning to a better generation after us, which will just say, why wouldn't you even?
Exactly. Right.
Like, this is just, it's life.
It's part of life, right? And there's no denying everyone experiences mental health challenges in life. Yeah. We all have ups and downs, right? Hopefully, though, that if we're normalizing these conversations, then people will feel no shame or discrimination. That's how people feel. A lot of people feel now, but hopefully we can get to a point where people feel that they can ask for help for a mental health challenge or crisis.
Equally as important, I think, is asking someone if they need help.
100%. And that's the other part of that, too, is that what we do with the Dover Mental Health Alliance is we want to really normalize these conversations so people will feel empowered to ask for help and also empowered to give help. Yeah. And that's the part that gets people. I was just at a meeting, I think I mentioned earlier, and that I think that mental health education is so vital just for the common lay people in the community at any generation. So you can recognize and respond to someone in emotional distress. You know how to approach them. You know what to do, what to say, and what the next step is. Like, how do you get them connected to the next step of help? And sometimes someone just needs a listening ear.
Yeah.
Just to maybe bridge the gap or just to de-escalate for a minute.
One of the hallmarks of working in an organization is that there's training. Mm-hmm. Staff development is something that we do consistently here in the city. And I have to say, probably the best staff development that I've participated in the past year is the mental health first aid.
Oh, that's great.
Having that sort of framing of it's not intrusive to say, are you doing okay?
Yeah.
And then being able to have the follow-up of, here's what I can do to help you if you need help.
Absolutely.
That sort of thing. I remember going through that course and then 2 days later observing other staff walk up to people on benches in City Hall and saying, hey, can I ask you a question? Mm-hmm. And watching that training be so effective, it was great to see that opportunity and think back on missed opportunities that we've had in the past because no one was courageous enough to ask that question.
Thank you so much for telling me that. Just to backtrack, so that's called mental health first aid training, and community partners received a federal grant, a SAMHSA grant, to be able to provide this training within Stratford County for 5 years. Hopefully, we'll continue to have this funding. I don't know if that grant will be re-upped in October of 2027. Cross our fingers. We'll see what happens. But right now, my mission is really to train whoever would like to be trained in that, because it does start those conversations. It gives people license to say it's okay to ask if you're all right. That's all right. And I've heard I know the two trainers, Lieutenant Matrucci and Katie Jones, who've been training the City of Dover, and they've told me some great stories of City of Dover staff connecting to resources or connecting to other employees or community members that might need help. Sounds like it has really opened up some doors, which is really good to hear.
It has. And one of the interesting parts of life is my wife works for another community. And she went through the training there. Alex and Katie went and did the training on another community.
Yeah.
And she came home and she was like, oh, you got to do this. And I said, I already did it. So it helped my marriage.
Yeah.
But it's a resource that I'm really proud that we're able to offer. And I'm glad that we were able to partner with you on that, because it's the type of thing that needs to be mandatory. And I'm glad we made it mandatory here. For all our employees. And I've been in discussion with our human resources director about having follow-ups and not having it be just a one-off.
Yeah, good.
Because whether it's new staff that come on or refreshers for existing, it's such a vital part of our
great
ongoing culture.
Well, that's really good to hear, and there's definitely more trainings out there. But also, I was talking to the city manager recently, as well as the HR director in City Dover, and the Dover Mental Health Alliance, modeled after a great program called the Recovery Friendly Workplace. Yep. But the Dover Mental Health Alliance has also created its own designation called the Mental Health Friendly Workplace. And so part of becoming a mental health friendly workplace is to go through mental health first aid trainings and some other trainings and some other criteria about, creating safe, affirming spaces, that kind of thing. But it sounds like city manager is interested in this, and I think it would be fantastic if we, through some more work, we can go and designate the City of Dover or Dover as a mental health friendly community. And we start to actually think about policies and other trainings and other, things we can do to enhance like the support and safety of not only the city staff, but that has to just trickle out into the community as well.
You mentioned the grant that provided the opportunity. And I don't want to become political on the podcast, but do you have concerns that the mental health awareness and the degree which we do it will become wrapped up in the DEI conversations or the woke conversations or all of these sort of external forces? Is that something that you it has to be, right? Something you're worried that it's going to be negatively impacted when they're separate and distinct conversations.
100%. Well, yeah, there's a definite concern that funding won't be there in 2.5 years when this grant ends. But the other things, DEI and the other things you were mentioning, is that's a real concern, because if you don't have safe or affirming spaces for people, no matter who they are, what they do, what they like, their identity, then that creates more mental health problems. So we have to ensure that people feel safe in their workplace, they feel accepted, because if they don't, then that is really going to be a detriment to their mental health. And then for any employer and employee relationship, it behooves employers to want to make sure not only that you keep your staff safe physically, in the buildings they work and all that, but it behooves employers to also keep people's mental health positive, because that can affect bottom line if you're a for-profit business in terms of financial consequences. It can affect people's work in terms of safety. I've done some work with actually an insurance company, and one of their people have developed this thing called psychological safety, which is another awesome training.
Yeah.
But she found that she worked within the construction industry, and there was a ton of workman's comp issues coming through. And she kind of traced it back to mental health problems. So there was not a psychologically safe environment within their organization, which led to stress, anxiety, maybe depression. And then she traced it to then they were getting hurt on the job. It's all connected.
I want to make sure that we cover resources and that the listener leaves the podcast not just enjoying the conversation as much as I have, but knowing that if they have questions or they want to get more information, how that can occur.
Yeah.
So are there simple resources, and certainly if there are links that we could provide in the show notes, that would be good. But is there anything you can easily direct people to?
Yeah. Well, first off, Community Partners is the Community Mental Health Center. That may or may not be the right choice for everybody. Yeah. They work with people with severe and persistent mental illness, but people can always start there. But if people are in crisis, though, we have 2 lines that people should know about. Is we now have 988, which is like the 911, but for mental health or suicide prevention, or if somebody thinking about suicide. Anybody, it's 24/7. People can text that line, but 988 is the National Suicide Prevention Lifeline. And I'm surprised at how many people don't know that exists, actually. The other one is New Hampshire Rapid Response, which is sort of our localized mental health crisis line. That number, I'll say it slow because it's a 10-digit number. It's 833-710-6477. That is also a line that people can call if they're having a mental health crisis or substance use crisis. They are connected with a mental health professional on the line, and sometimes that mental health professional can triage that call right then and there. But if they feel that the situation is acute, they can send a mobile crisis unit to that person, and then could help that person help them in the moment, whatever they need to do, and then connect them with services after that. Of course, we always say if it's a situation where it's a danger to oneself or somebody else, if you're trying to help this person, call 911. Obviously, 911 is there. And also, if you're helping someone that, might be a danger to themselves or someone else, you make sure you take care of yourself first. That doesn't mean ignoring that person, but maybe getting yourself first sit into a safe location and then calling 911 if, in fact, there's imminent danger at that particular moment. So those are a couple things. But another couple things, and I always talk about this, of course, but if people want to get involved with a mental health conversation, if people want to understand what other pro-social activities and resources are out there in the community, the Dover Mental Health Alliance, this grassroots coalition, we meet monthly except in the summer, but we meet monthly bringing community members. Any community member can attend, and we usually have educational presentations about a program, an initiative, an organization in the area that has services, whether it's helping somebody with substance use disorder or mental health or whatever it might be. It's always connected in that sort of way. But then we also usually try to have conversations within the group, and sometimes we have upwards of 55 or 60 people there, and discussing some topic about mental health or substance use disorder or something. Like we've had conversations in the past, like, when you're at the Thanksgiving table, and you have people with varying viewpoints and perspectives politically, how do you have a conversation where you can stay regulated and it doesn't get heightened? And those are the types of things, because those are difficult conversations that are happening all the time right now. So that's just an example of one thing we do, But also, we really invite the community to come be part of the coalition, because I know that there are people out there that want to help. They just don't know how. And so we welcome people to come. It's really a volunteer organization, and just being an ambassador for mental health or learning about mental health or going to these trainings that are offered in the community starts to really strengthen the entire safety net within the community.
As we wrap up, I want to note, I grew up here and I've lived here for a long time. And I've worked for the city for 28 years.
Yeah.
There are certain aspects that you look at the community and you're like, that's Dover. That's why people come here. That's why people stay here. You are one of those things. I can't say enough how appreciative I am that you're here today, that you're sharing these stories, this information. You really are what makes this community great. And I appreciate you being here, and thank you very much.
Well, thanks, Chris. I appreciate that. That's a lot, but thank you so much.
Have a great day.
You too. Thanks.
Dover has a wealth of history in its over 400 years of existence. Coming up, Mike Gillis is going to share some of that history with us.
This week in 1927, Dover celebrated Poppy Day, a special observance to honor and support disabled and needy veterans and their families. The John W. Christie Post, number 752, Veterans of the Foreign Wars, organized a movie show at the Opera House at City Hall with matinee and evening screenings to raise money for the Poppy Fund. The Ladies' Auxiliary of the American Legion, Dover Post number 8, also took to the streets selling poppies throughout the day. The bright red poppies have become a symbol of remembrance for those who sacrificed their lives in war, inspired by the famous poem In Flanders Field. Poppy Day dates back to the years following World War I, when the American Legion Auxiliary adopted the poppy as a memorial flower. The campaign was designed to provide financial assistance to veterans in need and support their families, many of whom had lost their providers or suffered disabilities during the war. Dover's event was a resounding success. All proceeds from the movie showings and poppy sales were dedicated solely to relief work for disabled and needy veterans and their loved ones. Dover observed Memorial Day yesterday at Pine Hill Cemetery, a tradition that has continued for many years. In the spirit of that solemn observation, we thought it important to recall another tradition, Poppy Day, even if not as widely known today as it once was.
Thanks for listening to the Dover Download this week. If you like what you heard, subscribe through your favorite podcast aggregator. And if you have something you want to hear a topic on, let us know. Finally, this is just one of the many ways we share information about the city of Dover. You can subscribe to the Dover Downloads email newsletter every week, or other newsletters that we have, by going to the City of Dover homepage, www.dover.nh.gov. Have a great week.